Welcome to New York City Health and Hospital Kings County YouTube podcast. I'm Dr. Melissa Lee, director of the Lifestyle Medicine Program. We are taking over this season's podcast to really focus on the launch of our Lifestyle Medicine Program. In this episode, I'm joined by Dr. Lucas Dreamer. Lucas is here to discuss substance use disorders and how this is an important pillar of lifestyle medicine. Lucas, thanks so much for joining us today.
Thank you, Melissa. I always had an interest in marrying physical health and mental health. And I really came of age as a doctor in the early years of the opioid epidemic. I inherited a panel of patients in my first job where there were a lot of patients with history of chronic pain, mental health problems, addiction problems. And they were used to getting a lot of high-dose opioid pain pills every month. They're trying to understand what was really at the root of their concerns and their problems, and trying to reevaluate their pain, dig a little deeper into their mental health conditions. I identified a lot of addiction problems and kind of explored that, found it very rewarding, and continued to pursue that as a specialty of mine.
That's fantastic, Lucas. I know that you've been spending time teaching and caring for patients in this field, and it's something that's so essential for all internists to have in their practice right now. So you're the perfect person to join us on this episode. So let's get right down to it. We often hear about the word dopamine, and I want you to help me understand what is dopamine and what does it mean about having high levels or low levels? Like, is this a chemical? Like, how does this work for us?
Yeah, great place to start. So dopamine is a chemical. It's a chemical that we make in our brains, and it does a lot of things. There's a lot we know about it. There's a lot we don't really understand about it. Certainly plays a big role in addiction. We believe it plays a role in depression, as well as in Parkinson's disease, in mental health conditions like schizophrenia as well. Specific to the role it plays in substance use disorders, an important thing to think about is the reward circuit in our brain, or the reward pathway in our brain. Why do we work hard to stay warm and find food and reproduce? We do those things because it's ultimately very rewarding for us. If we didn't have the reward pathway in our brains, we may lose interest and give up on those things and freeze or starve to death. So dopamine is the principal chemical in that pathway in our brains. And so obviously it plays a big role in what's satisfying, what's rewarding. The thing with most of the drugs is that you wind up getting a much bigger dose of dopamine than you would normally. And it sort of overwhelms your brain. And that's what leads to sort of dysregulation of that system.
And so I wonder, is that dysregulation that you're talking about, how does that tie into one's vulnerability to addiction?
Yeah, no, I think it's complicated. I think it does have to do with chemicals in an individual's brain and how they're working. It also has to do a lot with social factors and situational factors, the things that make someone more susceptible to addiction or more likely to develop an addiction is early exposure to drugs, early exposure to other traumas, and other sort of emotional or physical injuries along the way. It's complex. The sort of classic disease model of addiction suggests that some people have low levels of dopamine in their brain, and when they use a drug that simulates or increases those levels, it's sort of like the lights finally going on. That's true in some cases. Other folks come to drugs later in life, and not always easy to understand, but I think there's a lot of factors that play into it.
It sounds like a really complex web of kind of environmental factors as well as neurotransmitters and kind of biological factors.
No, exactly. That's what makes it challenging. That's really also what makes it fascinating to work with patients who are struggling with this, because you have to think about everything from these brain chemistries, these molecules in the brain, to social factors and their day-to-day life and the environment they're living in.
So what kind of long-lasting effects could there be on the brain after someone's using some of these chemicals?
So that's a good question. And that's what makes substance use disorder a chronic disease and what makes relapse, the risk of relapse, so high. The term I like to use to explain that is salience. When I'm teaching students and residents, I ask them to think about what's important to them, what's salient in their lives. And I joke that professional achievement and academic achievement obviously was to get us into and through medical school. And I ask them to consider if, rather than that, what's actually important to them is the next dose of drugs. That's paramount in their life. That's what's salient. That's what's important. And that transformation actually happens. That's what we understand. Changes in the brain over time with regular use of opioids or cocaine or whichever drug. And, really through flooding the brain and with, regular and heavy use of any of these drugs, you get much higher levels of dopamine in the brain. And that really does lead transformations to where things that typically would be rewarding no longer are. And the only way to feel normal, to feel well, is through continued drug use.
I'm really glad you discussed all of these different components of addiction with us. And, it really brings to mind why this is such an important pillar of lifestyle medicine. As part of our intake for all of our patients, we are not only screening for depression and anxiety and blood pressure, but also for substance use disorders. So tobacco use, alcohol use, other drugs. And I'm wondering, how can they be different?
Okay, another great question. And let me just first say that I think screening is really key. If you don't ask, you won't know, especially around things that people may have shame about. Further, a brief intervention for smoking, for alcohol, things that have been studied and are effective. So that's something that can be done in a primary care office, in your lifestyle practice as well. Back to your question, how do addictions differ? They're all the same in that taking a substance leads to some sort of intoxication and impairment, and doing that over time makes someone kind of used to and dependent on that substance, and that further kind of limits their ability to function in other ways. How they're different, I think, is important also. In some ways, tobacco is the most harmful drug that I know of, but it doesn't, at least not initially, turn people's lives upside down the way alcohol can, or cocaine or heroin can.
So I think in both of our long careers in primary care, we've had the privilege of caring for folks who are recovering from addiction, as well as for folks who are struggling through this. And I'm wondering if you've noticed any specific triggers that have made patients more susceptible to relapse.
Mm-hmm. Relapse is a challenging part of treating patients with addiction. Triggers really can be different for different people. An important thing to remember about addiction, most often people develop their drug habits in young adulthood and don't always form kind of mature relationships with themselves and with others, and really rely on their drugs for regulating their mood. So, you expect to see higher risk of relapse around periods of stress, trauma, reminders of trauma, anything that destabilizes things, anything that really is a change. How does someone regulate their mood? They look outside to take something to make them feel better. And that's a really hard habit to break, especially if we think about, as we understand the disease itself is really dysregulation of the brain chemistry. It takes a very long time for that to reset, and some would argue it doesn't reset.
That's a great answer, Lucas, and really kind of brings our questions full circle, because you mentioned many pillars of lifestyle medicine there. The importance of stress on our behaviors, the importance of healthy relationships. And I imagine sleep plays a role in all of this too. Thank you so much for joining us today, Lucas. It's been great. I know I've learned a lot, and I'm very grateful that you continue to be such a great teacher for our residents and our students, and such an empathetic clinician for our patients. Thanks for being here.
You're very welcome. Thanks for having me. Very happy to be here and share, and always a pleasure to sit down with you.